Thank you very much. I would like to thank organizers and participants. Psychodynamic Psychoanalytic therapies. They are confused a lot. In order to differentiate these two, I try to provide the very basics of each. Then I will be giving the details of the treatments. I don't know whether you have seen this form. I think you should know it, because this is Freud's handwriting examples from his one of articles. Psychoanalytic psychotherapies can be even more meaningful based on this scratch. Who is Freud? I think we need to know about his life. He says, I'm not a scientist, not an observer, not an experiencer, or I'm a conqueror, I'm a discoverer, I'm an inventor. He was born in 1856. His father is important in his life. After high school, he went to the university, but he was not very much enthusiastic about that. In 1881, he entered into medical faculty. He had difficulties in studying the school. He started to work in neuropathology. Actually, he was a neuropathologist. Then he started to work in Burkett, a physiology lab, and he was awarded with a prize because of his works in nervous system, biology, and psychiatry. But then, because of his financial situation, he gave up being a researcher and he went to Vienna State Hospital. Then he met with Martha Bernays. Martha Bernays was a daughter of a very wealthy family, and Freud had to earn more money in order to marry her. Charcot used to work with some hysteric people, and he started to work with Charcot. He learned some hypnosis and technique methods from him, but this hypnosis and psychoanalysis technique was a bit challenging for him, because he saw that these techniques were not very successful for some cases, but for some cases it was very successful. Burak was very popular back then. Freud started to work Freud's brain was very similar to today's computer systems. Freud's brain used to work like a computer. He can work on different things. Anna O was a very popular case. Berta Popanine showed very complicated symptoms. Visual impairments, tinglings, tics, and some horrible hallucinations. there were very complex symptoms of unknown, and it was not very possible to put a single diagnosis. And sometimes Pappenheim got into a mutistic scene. It was like autism, and she uttered different new words.
And in the study that he carried out with the Bruyère, he indeed defined those treatments as the speech cure. And she discovered that without any hypnosis, by remembering some of the information, another method might be employed other than hypnosis. As we all know, in this method, you are indeed trying to make use of the free association of the ideas. But in such an environment, in such a free environment, Freud is claiming that the patient might have some censorship mechanisms, and she has to identify some defensive mechanism. As you remember, Freud was a neurologist, and at those times the dissections were just initiated in the Europe, and these complex symptoms were tried to be explained biologically by her. Of course, at those times the technology was not well advanced, there were not emails, and she was corresponding with the Frust at those times and sending mails. And one copy of those writings were at her discretion, and the other one was going to her colleague. And here you see something very complex, and she was trying to explain the nerve system. There is Q energy, and the action potentials were defined at those times, and the synapses were not defined. And she thought that the energy was suppressed at those times, and it was stated that the nerve system is not without disruption, and there were some contact barriers. And then the synapses, which were defined by the Sherrington later on, was defined by her. And she said that in the contact barrier, most probably there are some materials, but I cannot explain it very well, but in the future, most probably it will be understood. So the neurotransmitters were explained by her without actually being defined. So in our modern psychiatry, the psychopharmacological agents were mentioned by her without knowing it. What happens afterwards? She tear apart her mail and put it to the garbage bin, and at those times she lost her father, and she started to do her own auto-analysis. And as she evaluates her psyche, she recognized some of the important symptoms, like the importance of the sexual life in the etiology, the symbols, the mistakes, and the resistance to the treatment, and a dipole complexity and the seeking for objects were defined. And it was also recognized by her that the sexuality actually initiates in the childhood, and it is totally different from the adult sexuality. And she said that the language of the sexuality during the childhood is about compassion, and in the adulthood it is about the lust. Of course, at those times it was criticized a lot because the Victorian age had just ended at those times, so the Europe doesn't have an open understanding about the sexuality of the people. But Bleuler was also supporting her, and in some of the journals she was defined as the surgeon of the psyche. And in here we should also realize that she benefited a lot from a lot of sources, even including the mythology and the psychological theories. As I told you, at those times the anatomical studies were just initiated, and she benefited a lot from the evolution theory. The subconscious theory was not mentioned by Freud for the first time. Fechner, in the psychophysical components, he was actually making references to the subconsciousness, but the Freud, with his iceberg theory, indeed became quite a pioneer. We know that Dr. Jekyll and Mr. Hyde in that story, indeed a doctor with two different characters were turning into a monster. Of course, we know that Freud was affected a lot and inspired a lot by Darwin. And Salave defined Freud as the biologist of the mind, and making quotations and references to the Darwin. And he said that Darwin was also dealing with the conflicts in our minds in the subconscious level, and he also underlined the importance of the sexual enthusiasm. And at those times in the Europe there were two different ideologies, the hedonism and the catharsism. And the psychoanalytic psychotherapy of the Freud to be developed, or the psychosexual development theory during the childhood, was indeed inspired by the hedonism. And she realized that the children, indeed the babies, are approaching to the indeed to hedonistic approaches, and that's how she developed her theory. In our clinical practice, she has three important theories. In order to understand the mentality from hysteria, she tried to understand the out of the consciousness. And she has the topographic theory. As she was mentioning to it, she was speaking about the mental determinism, and she was seeking for a causality, and she tried to understand that the mental life is actually taking place out of the consciousness. And this part is quite important, as we are in the Psychopharmacology Congress. Subconsciousness is not something without any foundation. It is transmitted and transferred phylogenetically, and it is constituting the core of the subconsciousness. And the subconsciousness is not something we empty, because it is nourished all the time. And in the psychoanalysis, these subliminal factors should be injected to the child. So this unconsciousness is indeed being fed with the visual images. As this topographic theory is not enough, then the structural concepts have been developed. Ego and superego was once again developed, and indeed the first theory is overlapping with the second theory. This iceberg metaphor can be easily understood. There is a psychic energy on the unconscious level, and the superego and the ego is regulating it, and some part of the ego and the superego is on the conscious level, but the other parts are on the subconscious level. There are instincts. There is an ego reality which is controlling it, and there is also the superego which is constituting the morality. Last but not least, he is defining the psychosexual development theory between the first 1 to 3 ages, the oral period, then the anal period is developing, and then the oedipal conflicts and the phallic period is going on, and then we reach to a latency, and then the genital period, which is going towards to the adulthood, is the reality in which the real genitality is being formed. But there is another concept that we have to underline here. There is a difference between the drive and the instincts. One of the things that she was criticized because of the children sexuality, she was speaking about those pleasure. All of us is indeed being born with the instincts, because those instincts are indeed being fed and nourished as we born. As the baby was trying to compensate the hunger, as she was drinking the warm milk coming from the breasts of the mother, then the first pleasure is being formed between the mother and also the children. There are also some drives, and all drives have its own aim, and the drives should be, and the urges should be fed and nourished. There is a resource of the drive, and there is an object which is fulfilling those drives, and it was elaboratively mentioned in his speech. If we think that those urges should be fed as a need, and if they are overfed or underfed, then a fixation, a problem will emerge, and as a result some symptoms will be observed in the clinic. In this tree theory, Freud tried to understand these symptoms, and especially after Freud, Melanie Klein tried to develop this theory, and Stirner and Spitz was the medical doctors, and they indeed try to confirm the truth of this theory by observing the children. So together with this structure, we might indeed evaluate in our clinical practice there will be an environment in which the catharsis will be taking place. So in line with those three theories, we should understand the meaning of the symptoms. And just think about the symptoms like a complicated puzzle. And first of all, we have to make sure that the catharsis will be taking place, and then we have to organize the relevant components into a puzzle. So this is not something easy all the time, but sometimes it might be quite hard to indeed add all of those components into each other. Maybe in the recent years the children might connect all of those parts. So in this theory, Freud is saying that the mentality cannot be totally controlled because of the unconscious factor. And all of those theories are defined as the three important wounds for the human history. It is not easy to understand those unconscious factors. So many people might have told me that I am a lunatic, but I developed this theory. Of course, some of the things might be suppressed. For example, dreaming. We dream all day, and this is one of the most important tools for us to understand the unconsciousness, but we don't remember all of them, and it doesn't mean that we don't understand it. But it is not easy to dream, it is not easy to understand the dreams. It might be quite expensive, but this is all what I would like to say. I hope to see you in the question and answer session.